Okay, so with the IV, we always start at the hand and work up to the heart. So you have your supplies. If you refer to that picture I sent to you all. Make sure there's no reason why you can't use that specific arm. Kind of the same rules as venipuncture. So again, we're going to put the tourniquet a few inches above where we plan on starting. If you do the warm blanket ahead of time, then that really makes their veins distend. Cold skin is like shoe leather in some people, so you definitely want to make sure. So select your vein. Okay, drop your tourniquet. Behave yourself. Then, just kind of like you did for venipuncture, we're going to prep the site first because this chlorhexidine takes a while to dry sometimes. So, we'll go horizontal, and I like to clean the entire area that's going to be under my tegaderm. That way there's not a high population of bacteria under there. I'm going to do my verticals. And then my circular. I like to hit it from all directions. So I'm actually getting those microbes off the hair follicles. So in someone that has a hairy hand, then you're going to use your clippers. So remember, you're not going to touch that side again while you are waiting on it to dry. Now what you are going to do is, while that's drying, you're going to assemble your supplies. Make sure you can see that. So, kind of like with venipuncture, you have some work to do while that's drying. So this is your saline lock, and you'll still hear nurses call it a HEP lock. So it's sterile in the package, but what you want to do is you want to prime this with some saline. 10 ml syringe, always pull back to loosen that plunger because that plunger swells and gets stiff on saline flushes. And when you're in the room and you just push, you're going to end up giving yourself and your patient and whoever your other bystanders are a shower. So this attaches to the blue end. This end has no rubber on it, so you know that it doesn't go there. This is the part that screws on to the actual IV catheter. So I always do it the hinge method, because if you try to go straight in, it'll slide off and you might contaminate your syringe. So I do the hinge attach. Doesn't take much to prime that. I think it's 0.03 mils. It's really a small amount. So I just leave that there. Now this, I do recommend that you go ahead and loosen that so that you can just flip it off the end when you're ready to put it on your IV. And if the inside of this package, if you haven't contaminated it, which it's kind of hard not to do, then you could actually leave that off as long as you don't contaminate it. So you're going to have these things handy. You're going to have your IV tegaderm, and it's sized just exactly for that. It has a built-in label, so you can label your site as well. Now, some places you work, they have what they call blood control IV catheters, and those do not bleed. They have a special membrane that prevents the blood from coming back out. But for the purpose of lab, we don't have those. So you're going to have you a couple gauze, because you'll need to put those under there. If you have a patient that's visibly sweating, or you can tell tape is not going to stick well to them, then you want to prep that site before you stick it with a skin barrier, skin protectant, whatever it's called at whatever institution you end up at. For the purpose of this guy, he likes tape, so we're good. And then again, we're going to put our extra tape on the back of our glove. But for this time, we're going to put it on our non-dominant hand. And you just need a couple of little pieces. So I split it in half. And that way it's handy. And then you have your IV catheter. For the purpose of lab, we don't use anything larger than a 22 gauge. 24 is the smallest we have. And this is the last thing I do whenever I'm ready to put my IV in, besides put my tourniquet on. And we'll talk about that in just a moment. I'm going to go ahead and reapply his tourniquet. Okay. Cross, stretch, stabilize. So grab that with your thumb after you get that stretch in there, or you won't get it tight enough. And if they're dehydrated and you don't get it tight enough, then you will. So same thing on these. Pull away. This has a white button on it. Be careful. You do not want to push that button until you are done and in the vein. You will get a flash return. You'll usually see it coming along the plastic catheter that's right here that goes over the needle. So you'll see the blood return pretty quick on that. And then it'll fill up in this chamber back here. Once you're ready, after you drop your tourniquet, then you'll push this button to remove the needle from the inside of that catheter. Okay? You never remove the needle out of that, straight out, because we don't want any sharps covered with blood out here for someone to get stuck with. Be careful of this button, because you're keeping your fingers on top, all right? Or you're going to get the wrong angle. Just like in venipuncture, if you have the wrong angle, then you may not hit your vein. If you try to go flat too soon, you're not going to get it in the vein. When the long tip of the bevel punctures the vein, you have got to drop down to 0. So as soon as you see your flash, drop down to 0 degrees. And that's about 1/8 of an inch from the tip of that catheter to the tip of that top of the bevel. So button up on IV catheters is bevel up. These catheters have a notch that they sit on. You have to turn these to break any possible seal that occurred during the manufacturing process. Do not ever touch below the blue, because ideally that's what's going into the vein, and you don't want to contaminate the vein, because these are only clean gloves, not sterile gloves. Okay, and I'm not left-handed, but we'll do this. So in the hand, you're going to reach between those fingers and pull back. And then I'm a merger, which means I like to go in on the side. That way, if I have to back up, I have somewhere to back up to. So it's going to be a stick. And I see my flash, but because the blood's not bright red, you don't see that. So I'm going to drop to 0, advance that little smidge. Then I can slide my IV catheter in. you're just sliding it off that needle, but you're still leaving the needle on the inside. It's just the sharp part of the needle is now recessed in that catheter, so you're not jabbing through the back side of that. So I'm going to drop my tourniquet. I'm going to get one of my gauze right here because I know he's going to bleed out of that. Okay, and you don't want blood under your tegaderm. I'm going to get this ready. I can drop that off because when I push this button, I have got to get this on there so that I can plug the hole and I don't make too much of a mess. Now you apply pressure on that vein above the site, push that button to retract the needle, then you screw on your deal while you stabilize. So as soon as you get the hole plugged with that tubing, you can stop holding pressure here. You can aspirate a little bit of blood just to make sure you're still in the vein. I mean, as much as it bled out, I knew I was in the vein, but still. And then you're going to flush. Anytime we flush any type of vein device, we're going to use a kind of a surging technique. So like that. On central lines, you really push hard, but on peripheral lines, you don't, because in people with weak vessels, then it can blow. So we only have to flush with 2 mils on a peripheral line. So I'm going to take that syringe off since I did my 2 mils, and I'm done with that. Now I'm going to take this tegaderm, peel it off, and then this is kind of like a viewfinder right here when you pull, because we want to cover that entire blue part. We don't want anything else under our IV with that. So if your site is clean, see if I can get you the angle. And he's not moving around, so I don't have to worry about his falling out. Okie dokie. Turn our arm. Okay, so like I say, that part spreads apart. I can use it for a viewfinder, and I am covering only the blue all the way up to where I screwed that saline lock on. Okay, just like that. Then I'm going to squeeze around that IV catheter to try and make it good a seal as I can. And then we peel this off, beginning at one side of that notch. Okay, good seal. So then we're going to write the date, the gauge. So this is a 22 is blue. Just remember that's the one that rhymes. And then my initials. And then we put that on the side of the vein, on the side of the dressing that won't obscure the view of our vein. Okay, so I doubt anyone would have to look at these veins over here, so I'm going to put it over here. So we can still see the vein and check for phlebitis and our IV site. And then if we needed to look at another vein in the hand, then we can still see it. So just be thinking ahead when you put these dressings on. So you're going to see different taping techniques. We used to tape under this, but we no longer do that anymore because tape is usually dirty. You're going to see some that tape like this on top of the tegaderm, and that's okay until you need to take this dressing down. So maybe your IV kinked underneath there, maybe you're just wanting to troubleshoot to see if that's the problem, because you can just kind of take the dressing down and straighten it out and then reapply a new one. You will, after about 24 hours, you will not be able to get that tape off without tearing It's a nightmare. Anyway, just saying, it's a tape mess and you have to wear gloves, and that's no good. You'll see someone that'll do what they call a chevron. And since this doesn't have wings on it, then it kind of defeats the purpose of a chevron. Some IV catheters have little wings that sit out here, and they have little holes on the sides, and those are suture holes, just in case they want to use it for an art line. Some doctors prefer that. So a chevron is just going over and then straight down. And again, that goes on top of the tegaderm. I don't like anything on my tegaderm. So I just usually tape straight across above the tegaderm. So that way I can get the tegaderm off, and I bring it around and I pinch it around the tubing. So I'm not taping that down into their skin, creating a pressure area. And then I'll usually slide that saline lock over on the skinny part of the tubing and do the same thing, pinch it around, and then tape it down like that. That way I've got it stabilized. I've got the end of my tubing here stabilized, and it's pretty comfortable for the patient that way as well. I don't know how many of you have discontinued IVs, but this tape method makes it the easiest to take these out, because the only thing you have to do is peel down the tegaderm. When you have the chevron or the ribbon method, you have to get that tape off and around from that, and then you can take your tegaderm off. So it becomes very stressful. So just be thinking ahead when you start IVs. Is your patient combative, moving around? Maybe they do need that extra tape, but if they're just coming in for a procedure or two and they're not sweaty and they're cooperative, then just the one piece of tape across the top is good as well. And I think that's it. If you have any questions, just shoot me an email.